I would like to acknowledge the First Peoples of the Milwa Mallee, the Latchi Latchi, Nintate and Neri Neri, as the traditional custodians of the country on which we are. We pay our respects to the elders, past and present, of the First Peoples of the Milwa Mallee and the ancient connection they hold with their country.
My name is Megan Kelly. I am the Aboriginal Health Promotion and Chronic Care Worker with the aim of encouraging preventative health care and improving health outcomes for the Aboriginal and Torres Strait Islander community. I am located in the Culture Hub at Sunraysia Community Health Service, which offers a safe cultural place for Aboriginal and Torres Strait Islander clients and is home to several community development projects. I would like to dedicate this Aboriginal Torres Strait Islander Advance Care Plan booklet to my nan, Joan Elizabeth Kelly. The idea came from when my nan became ill in 2015. My partner and I were having trouble visiting my nan in the palliative care ward at the Mildura Base Hospital. We had to get permission from one of the family members to visit my nan, which at the time we were not on speaking terms. I was determined to develop this Aboriginal Torres Strait Islander Advance Care Plan booklet for the Loddon Mallee region by giving our mob a voice that are in a similar situation. Thank you.
My name is Simone Heald, CEO of Sunraysia Community Health Services. I'd firstly like to acknowledge the work of Megan from Sunraysia Community Health and Jess from Legal Aid and all other stakeholders involved in the development of the Advance Care Plan for Aboriginal and Torres Strait Islander community. Sunraysia Community Health has a strong, valuable relationship with Victoria Legal Aid, working collaboratively within our Health Justice Partnership for the benefit of our community. This work is a further example of this. I'm very proud of Megan's achievements in developing the Advance Care Plan and implementing one that is culturally responsive to the Aboriginal and Torres Strait Islander clients and families. It is the personal stories of our staff and community which contribute significantly to the enhancements we make at our service. In acknowledging this, I would also like to dedicate this plan to Megan's nan, Joan Elizabeth Kelly. Sunraysia Community Health Services continually strive to ensure the services we provide to the community are individualised according to the needs of each particular client. The Advance Care Plan helps us to achieve this with our community. Taking the time to go through the Advance Care Plan with clients and families, discussing and writing it all down allows for planning for current and future healthcare. Whilst illness can be a difficult time, it can also create some nice memories for clients and their families. Together, families can talk about their illness, talk about their wishes, and this then enables families to help the clients maintain their wishes and advocate for them when required. The Advance Care Plan gives clients and families the tools to have these conversations that we don't normally have. These times provide families an opportunity to laugh, time to cry, but also time to love each other more. This plan ensures a respectful and appropriate approach to advanced care planning for Aboriginal and Torres Strait Islander community to ensure their end-of-life journey is inclusive of their individual preferences, values, beliefs and cultural heritage. Once again, a huge thank you to everyone involved in this, from the commencement of the idea through to our booklet as it is today. Thank you.
My name is Heidi Deason and I'm a lawyer and also manager of the Victoria Legal Aid office here in Mildura. Victoria Legal Aid have a health justice partnership with Sunraysia Community Health and we're co-located in the building here at 13th Street. The reason we have a health justice partnership is really because it's so important for people to get access to legal information and at the right time. We know that so many people don't get access to the legal information they need, and there's a whole range of reasons for that. We know that often even getting access to lawyers is a barrier for people. Getting access to information in a way that they can understand is a barrier. And also, I think possibly people are worried about losing control of the solution if they ask for help. And the Advance Care Booklet is really an example of some of this work and how we can overcome the barriers to people getting the right information at the right time. So from a legal perspective, it's really important for people to be able to understand and navigate the law so that they can take the action that empowers them. And this doesn't always mean seeing a lawyer. In fact, sometimes that actually stops people getting access to the right information because they delay it. So resources like the Advance Care Planning Booklet is a way that we can get the information directly to community so that they can make the decisions for themselves. So I just want to congratulate Megan and Sunraysia Community Health on all the work they've done for this booklet, and the contribution that Jessica Thomson has made as well, who's from our Victoria Legal Aid Office, because I think it's going to be a really powerful and great resource for our local community.
My name is Jess and I'm the Aboriginal Community Engagement Officer with Victoria Legal Aid in our Mildura office. I'm lucky enough to work closely with Megan Kelly, who is the Aboriginal Health Promotion and Chronic Care Worker at Sunraysia Community Health Service, as part of our Health Justice Partnership. The idea behind a Health Justice Partnership, and why Megan and I work so closely together, is because research and our own experience shows that legal issues don't happen in isolation, but are often connected to or exacerbated by health issues, and vice versa. Clients are more likely to identify a health concern than they are to seek help with a legal problem. One example of where we often see this overlap is in the area of advanced care and end-of-life planning. Both Megan and I have together seen the difficulties that arise because the legal side of these issues is really complex and is often occurring at the most difficult time in a person's life. Making and recording these decisions in advance can be really confusing and difficult, might not be seen as necessary. Me and Megan noticed how little information was reaching into the community about how to make these decisions and what they mean. More importantly, we've both seen the extreme difficulty and added stress on clients and families where these decisions are not recorded in advance. The Advance Care Planning Booklet has been specifically designed to help mob understand decisions about their healthcare preferences and what they want to happen if they get very sick or pass away. So the importance of the booklet is that it can avoid these complex legal issues if you become too sick to make the decisions at the time and your family members or health providers don't know what you will have wanted or disagree about what should happen. Making sure that you have power and control over your own end-of-life care and that family is involved in these decisions can be really important to a person culturally, but can be overcome by legal barriers and hurdles if booklets like this don't exist. And so the work of Megan and all involved in bringing this booklet to fruition is so commendable, and the benefit that this work could have in the community is immeasurable. These benefits will be seen by health and legal providers alike, but most importantly, in ensuring the autonomy for health decisions remains with the patient and their family.
Hello everyone, I'm Mel Livens. I'm the local palliative care nurse consultant for the Loddon Mallee region. I work here at Sunraysia Community Health, and first of all I'd like to say well done Megan on a wonderful advanced care planning booklet. Much needed. We've already rolled it out and we've had a couple of clients use it and the feedback's been wonderful. A little bit about our service. So we have a consultancy service plus the community service, and we see currently over 200 local clients on that. Offer a bit of a bereavement follow-up as well, and I just think that this is a step forward in planning for everyone's end-of-life care and the choices that they want to make.
My name is Charlie Davis. I'm from Wumbarai Nation. I'm an Awabakaleen Wiradjuri woman. I'm born to the sea. Today I'm here to discuss sorry business of part of being involved with an advanced care planning document that was put together by Megan Kelly and a group of representatives for Sunraysia Community Health. So I would particularly like to introduce you to the concept of sorry business. In First Nations people's world, sorry business is a very complex field. It's not something that is entered into lightly. Sorry business refers to the death of a particular person within a kin group or within our community. It is looked at not just on an individual basis, but also as a community-based process. We, as First Nation people, have protocols, practices, which we recognise and have obligation to carry out. These practices can last for a couple of days, to a couple of weeks, to a couple of months. There is no set time frame. We also have special traditions or storylines in which we follow. These storylines pertain to gathering at either the place of where the death took place. It could be in a kin's home. We would carry out a smoking ceremony. This smoking ceremony would be done within the kin group, and it would also be done at the memorial service or the sorry business service of the person who has passed. Sorry business does not just pertain to the death of a person, it also pertains to the loss of our land, our loss of culture. So depending on what situation we're in, if there was a practice against native title, some may enter into sorry business. So depending on the nation in which we are born to and the nation on which we practice, there are certain protocols and practices. Those practices can relate to a smoking ceremony. They can relate to having to have your hair cut at the time of the passing. It may be that your face or your hair can be covered with white pigment. The other thing is we do not speak the name of a person who has passed. The reason for all these practices is so that we allow the spirit of the person who has passed to enter into their world of the dreaming, and their spirit is not affected in any way. It's a very significant point that I have just mentioned, because we not only celebrate the person's life, but we celebrate their continued life thereafter as the return to the dream. In regard to our policies, procedures, practices and storyline, people from across our country they do not practice all the same. And I think we must be able to pay respect to the way in which each and every nation has different lines to the way in which they carry out sorry business, even to those of the Torres Strait Islands. Their practices are significant, take on different forms to what my people do, and especially the practice of presenting the tombstone, which is usually 12 months after the passing of the person, and great ceremony would be practiced at that time. I think it's important that we understand the policies and practices that happen across Australia, on our islands, and if our care plan is able to show that to non-Indigenous, non-Torres Strait Islander people, I think we have achieved a really, really miraculous goal. The other thing is sometimes people don't know what to do or what to say to us as First Nation people because they don't understand our practices. By engaging with the health professionals, they then get to have some understanding and can enter somewhat into our world during the time of somebody's passing. The other thing that's very important in our community is during the time of sorry business, one must get permission to enter into country where somebody has passed. The other thing is that we do not hold meetings or other forms of ceremony out of respect for the person who has passed and for the community which has suffered the loss. I've had the privilege to work with Megan Kelly on the Advance Care Planning document, which is a document that talks about what we would like as people, who we would like involved in our care, who we can share our practices, our obligations and our responsibilities with when we are at a time in our life when we may be about to depart. This document is not done a couple of days before our passing. The document is done in time so we are able to celebrate our life with those people around us. It allows the people around us to know what cultural practices, protocols and traditions we would like carried out, which I believe is very significant, especially when at times these practices are not openly practiced. Bringing together such a document as this helps us to actually articulate our culture to others around us who don't necessarily understand our purpose of sorry business.
My name is Christy Jane Kelly. My tribe is Barrambinia. My artwork represents the Murray River turtle and how it came to have a shell. It also describes how if there is no river, there will be no river life.